How the normal shoulder works is there's a lot of different structures involved, but in essence, it's a very complex joint that allows your body to orient your arm and your hand in space. And the main issues, again, that we see day in and day out, and that I experience, and I'm sure you do too, are the overuse type things. And you probably have seen on the internet or talked to people about, I've got shoulder impingement, and the definition of that is basically individuals that have done repeated overhead movements, and it basically squeezes this rotator cuff tendon in between the ball here and that acromion bone, or part of your shoulder blade. There's an associated bursal sac, which is basically a very small, thin, fluid-filled sac that hopes to try and decrease the friction between those two areas. And as that inflammation occurs, it not only inflames the rotator cuff tendon, but it also inflames that bursa, so you get a very irritated shoulder. People will come in and they say, I can lift to it here, but anything beyond that just kills me. I can't do it. Same sort of thing from the side. And they've got good motion, they've got good strength, but they just can't get that shoulder where they want to because they're just so sore. So symptoms associated with it, we kind of talked about these, are basically pain with overhead activities. There's no significant loss of motion, and there's no significant weakness associated with that. The treatment for it is usually non-operatively initial. Usually try with cortisone shot, try some rotator cuff strengthening exercises, and that a lot of times will resolve the symptoms. If it doesn't, and the MRI shows that there's no rotator cuff tendon tear, sometimes what you have to do is do a decompression of one of the bone spurs that can irritate it. AC arthritis is a little different entity. So the AC joint is, again, the acromion, which is the outer portion of the shoulder, again, the roof over the ball and socket joint, and the collarbone, so that's the AC joint. A lot of times you can get arthritis in that joint specifically. As we age, all of us get arthritis in that joint. It just depends on who's symptomatic as far as what your treatment entails. Some individuals that lift a lot of weights, a lot of the big bulked up football players and that sort of thing, can develop this a lot quicker than me. I'm not a very big weightlifter, as you might imagine. But as you develop this, the main symptom that you complain of is that it really bothers me to reach across my body. The reason for that is because every time you do that, that joint narrows. So this acromion bone is abutting into the collarbone, and that's why it's so irritating to reach across your body. Again, pain is mainly located directly over that portion of your shoulder, so you can they generally will say it hurts, and I can recreate it just by pushing right there. The patients generally, again, have normal range of motion, which indicates that their ball and socket joints functioning normally, and normal strength, which indicates that the rotator cuff is functioning normally. If you come in and you have AC joint arthritis, a lot of times we can try to inject that, see if we can get it to get better on its own. If it doesn't, then a surgery is usually something that we do. And this AC joint pain, a lot of times, comes along with impingement. So if you're in that shoulder joint, you look at their collarbone, and it looks pretty bad. Most of the time, we'll go ahead and just do a decompression and take the end of your collarbone off. Shoulder stiffness can occur. You may have heard of somebody that's got a frozen shoulder. The medical term for that is adhesive capsulitis. And basically what that is significantly decreased range of motion. Those individuals will come in and say, I had a traumatic injury and my shoulder was sore, but now I can't move it. Or they'll come in and say, I can only move it to here, and once I get there, it just feels like it's completely stuck. Once the extremes of those motions, both to here and rotation, once you hit that area where it's scarred down, it really hurts them a lot. They can't get past that, and it's real sore. It can occur with or without an injury, like we said. It's often associated with diabetes, thyroid problems. There are some reports associated with it being associated with breast surgery or cardiac surgery post-operatively. But this is something that generally will improve on its own with therapy, injections, but sometimes it can take a real long time. It can take up to a year for that sometimes to happen. And some people just get to the point where they're so frustrated that they can't wait that long and they just want something done for it. And you can go in there and manipulate the shoulder, and you can go in there and trim that scarred capsule down to the point where they can get the normal motion that they're usually associated with. The other cause of stiffness in the shoulder is arthritis. And this is something that is a very common problem. It's not usually as symptomatic as hip and knee arthritis because it's a non-weight bearing joint. So most people will come in and they say, you know, I've had my hip, I had my knee replaced, and now my shoulder's killing me. You know, pretty good indication that they've got some shoulder arthritis. Not all the time, but it certainly is correspondent. There's two types of arthritis. One is osteoarthritis, which is wear and tear, and the other one is some people that have a rheumatoid arthritis. And that's an autoimmune disease. I know that's a big word, but basically what that means is that your own immune system attacks your normal tissues. And so with rheumatoid arthritis, it attacks the lining of joints and the cartilage surfaces of joints. And so those are the two main causes of arthritis that can give you some shoulder problems. So the symptoms, again, are painful motion, that's decreased motion. A lot of times they'll feel popping and catching in the shoulder, but a lot of times they'll have normal strength if their rotator cuff is normal. There are some patients that have rotator cuff tendon tears on top of the arthritis, and that changes the picture of what those folks need as far as surgeries go. But the main treatment for generalized osteoarthritis or rheumatoid arthritis are generally anti-inflammatory pills, injections, physical therapy. If those all fail to improve the shoulder, then a shoulder replacement surgery. So rotator cuff tendon tears usually occur in folks that are over 40 years old. Again, the kind of the shoulder injury, the different shoulder injuries are a lot of times age dependent. So if somebody comes in that's a certain age, you kind of have narrowed down your differential diagnosis of what may be wrong with to that age group. So these are usually age 40 or older. They're usually a result of wear and tear, and basically what happens is over time, that bone spur that hangs down off the end of this shoulder blade kind of digs a hole into this rotator cuff tendon just because of repetitive overhead activities. It can, again, just like we talked about before, occur with a fall. So those people that are over 40 that fall and dislocate their shoulder oftentimes can tear the rotator cuff tendon. So there are two different varieties of tears. The symptoms initially are pain with overhead activities, which could be impingement or it could be a rotator cuff tendon tear. These individuals, as opposed to the impingement folks, tend to have weakness associated with it. So if you test their strength in clinic, they've got significant weakness associated with it. Whereas the people with impingement have nice, solid, good strength. So again, just like most shoulder problems, we try to conserve things and see if we can't get you better with an injection, a little physical therapy. If we can't, then surgery is always an option. In summary, the shoulder is a very complex joint that allows you to get your hand and arm in space where you want it to be. The disorders that can cause you shoulder problems can be characterized by really 4 or even 5 various criteria. Where the pain is located, is there weakness or not? Is the range of motion normal? And are the provocative tests that you do recreate that pain, or are there specific points where the patient can push and say it hurts right here? And then again, I think the 5th one would probably be the age of the patient would help you determine exactly what's going on with those.